Thanks a lot for staying with us. You're watching TVC Breakfast. Let's talk health now. The Nigeria Center for Disease Control and Prevention, the NCDC, has confirmed 67 monkeypox cases out of the 1,031 suspected cases in 23 states, as well as the Federal Capital Territory. Enugu, Bayelsa, and Akwa Ibom states have reported the highest number of cases. The NCDC Director General of the agency, Dr. Jide Idris, assures Nigerians of enhanced surveillance to detect and control the outbreak. Monkeypox, a rare viral disease, can spread from animals to humans or even between humans. This through direct contact. And the symptoms include fever, headache, body aches, weakness, swollen lymph nodes, and a distinctive rash. Joining us now via Zoom from Abuja is public health physician. He's also a health promotion specialist, Dr. Obina Ebirim. Thanks a lot for joining us, and we hope to get some more insights regarding the prevention and control measures against monkeypox. All right, let's begin with your thoughts. It's the second time now that monkeypox will be declared a global health emergency. Does this capture, or is Nigeria also going with the seriousness that the WHO has given this disease?
Thank you. Good morning, everyone. So yes, I think that there's some level of seriousness that have been shown by government in terms of improving surveillance, heightening the alert, especially by the Port Health Authority at the point of entrance, and then also the planned vaccination against Mpox that is starting in early October. So these are signs of seriousness, but there are still more that should be done, and it shouldn't just be left for the federal government to take these actions. The state government needs to also come on board and support the federal government, so there is a holistic and coordinated action to stop further spread of Mpox or importation of cases from neighboring countries.
You mentioned that state government should come up to help the federal government in addressing these issues, but a lot of these state governments, always go cap in hand to the federal government for some form of help or the other. What can the state governments do to help federal government in curbing this situation?
Yes, so a couple of things. First of all, most state governments are not funding surveillance in their states. And then their health budget is minimal. They are only most times quick to release funds when there is a counterpart funding. Someone is bringing money to add up. But state government needs to fund surveillance. Now with the case, at least one case in all the states of the federation apart from Borno State, and we know that this may be because of it's underreported. State government needs to now invest more in active case tracing, ensuring that there is isolation wards in case there is a case to isolate and then properly manage that case. The state government also needs to invest in the training of health workers. One of the ways Mpox is spread is by when you're treating someone or managing someone who has a case and you have come in contact. So health workers need to properly train, provided with appropriate PPEs to stay safe. And some of these things are things that the state government can take up with their health budget. I know that buildings are good, but then also we need to strengthen our health system to be able to manage outbreak of this nature.
Right, and then let's look at how beliefs, erroneous beliefs, may be fueling the surge that we are experiencing now. First, do you agree that there is a surge? Did you get the question?
Yes, yes, there's a surge. Just a few days ago, the NCDC released a number of confirmed cases, and it's at 67. And this is just the last time they did such release. It was about 30-something, and this is almost a 100% increase within a very short while. And then this is not just only in Nigeria, but in African countries, there's also been that surge. So it's something of concern, and we need to take really proactive measures to stop. One of the, we are, I would say, a bit lucky that the strain we're having in Nigeria, the 2B, is not as severe as the 1B that's in our neighboring country, Cameroon. So we need to ensure that everyone coming in, especially from places like Cameroon, the epicenter, Democratic Republic of Congo, are properly screened. And if they have symptoms, they are quarantined or kept at least for 1 or 2 days until it's clear that they do not have Mpox. And that's one of the ways we can prevent importation of this disease into our country, especially that very severe 1B form that's quite severe.
And then the issue of the misconceptions, do you see that as a big challenge where, residents or people, especially in the rural areas, may have some misconceptions that are fueling the cases that we are experiencing now?
Yes, obviously, if you go to local communities, especially where the awareness is very poor, a lot of people have different beliefs about Mpox. With the skin lesion, people can say, oh, maybe it's due to maybe a sin, or maybe because of one, you've offended the gods, in quote. And then people are not taking the recommended ways of kind of making sure you're isolating that person. You're not coming in contact with the skin lesions, right? And then some people are also not listening to some of the advice to avoid some of the animals that, in terms of handling those animals, eating and killing them, that is known to transmit Mpox. So such erroneous belief, misinformation, and then also with the vaccination starting, we should prevent people from getting this Mpox. We know that there are some people in remote communities who will start passing a lot of fake news, misinformation, which will then prevent us getting to that coverage, vaccine coverage rate that we need to be able to protect, especially those at risk, the health workers and all that. So these are various ways that false belief, misconception, and misinformation is fueling both the transmission, the spread of the disease, and also hampering some of the protective and preventive measures that are being put in place to prevent a further spread of this disease.
So you also mentioned about borders now, saying that we should have testing facilities, but we have bedeviled by situations where we have porous borders. We have a few legal borders and a lot of illegal borders in the country where people go in and come out at will. How can this be effectively manned, of course, in addressing this issue of monkeypox?
Yes, I'm happy you raised that point, and that is why when you're managing a situation of this nature, you need to have a holistic approach. So this calls for strengthening our borders, making sure that our port health system is strong. Especially borders, we have a border with Cameroon, and I talked about the very severe strain that is spreading in Cameroon that must be prevented from getting into the country. So yeah, we need to strengthen our borders. We need to strengthen our port health authority. There's a lot of people coming to this country every day using two major flights that really apply the African continent. So everyone coming off that flight needs to be tested, and if they have fever, they need to be isolated, because with Mpox, the rash starts at 1 to 4 days after the fever. So someone might be infected and just have fever and you're not seeing those rashes. When the rashes come, it's easy to really see and know that someone is infected. So I think we need to, and then also those health officers need to be trained. You'll be surprised that some of them do not even know some of these symptoms, and some of them are also, we also need to make sure that they are upholding the ethics of the profession. Some of them might just overlook things, maybe because of the one favor or the other. You know how it is sometimes when you're getting into the country. Yeah. So some of these things are things that we need to strengthen, train our health workforce to ensure that they are helping us at this very critical time to prevent importation and spread of this disease.
Yeah, and then looking at the peculiarities of Mpox, when you compare it to smallpox, to COVID, and the likes, how do you help, or how do you expect that one will navigate around these issues? Because research says that there is a standard survival rate of Mpox, but in terms of quicker responses, what are your thoughts in beating Mpox in Nigeria?
So I think our best shot is to prevent its spread, because right now there is no really approved treatment for mpox, although there are some drugs out there that is undergoing some clinical trials. So our best bet is prevention. And how do you prevent? I've talked about the vaccination program. I would encourage all those who have been marked to receive these vaccines to ensure that they get vaccinated. And then also, we need to do simple things like washing our hands. One of the ways where that mpox is spread, it's by touching surfaces or someone who has a lesion. So simple washing our hands could prevent mpox and many other infectious diseases. Also, as I mentioned, government should do more in terms of improving surveillance and some of the control measures that are required during this period. So our best shot is really to, and then also people should avoid, a lot of people are still trying killing monkeys, rodents, and some of these mammals that help in the transmission cycle of mpox. So people should detect, and then also there's also spread through sexual contact, right? So some of these things are ways that are known to that mpox spreads. And what my advice to everyone watching today is, please apply this preventive measure, so that you are not an agent of spreading mpox, and then we can keep our communities safe. So our best shot is prevention. Get vaccinated and apply those preventive measures. The easiest one is just washing your hands.
Okay, so start washing your hands, and maybe we shouldn't
stay away from those wild mammals. So this is not a time to be eating, killing and eating bushmeat.
What did you just say? Excuse me?
I'm saying that this is not a time to be killing and eating some of those mammals we call bushmeat. So please stay away from it for this, at least for this period. And then also wash your hand, and then government.
I'm sure you've eaten bushmeat and Gary before, so you understand how the sweetness of all of that. So, okay, but you talked about approved treatment now, and many a times when all of this happens, many people call for homegrown local treatments to be looked into so as to get solutions to this. Now, there is no approved treatment for monkeypox, but there's also been calls for the use of herbs, looking inwards, especially in Nigeria, to get this treatment for these kinds of sicknesses. Do you think that traditional medicine and orthodox medicine can come together to get a solution to all of this?
So I would rather say that we should fund research and innovation. I believe that a lot of herbs, shrubs, seeds that we see in our country, they have components that are medicinal in nature. But also, one danger is that while they might have that component, they might also have another toxic component, right? So therein lies the importance of research, right, of innovation, right? How do we then begin to carry out research to find out how can we extract those active medicinal components and turn them to drugs that go through the standard clinical testing and procedures. So when people ingest these drugs, they get those medicinal value without compromising their health, right? So this is something that we need to. So a good example is, for example, the vaccines we have in country at the moment against mpox is donated by the US government, thanks to them, right? But that's just about 10,000, which would, given a double dose, which would just take care of about 4,000 to 5,000 persons, right? But, and in 6 states, right? Because that's how the plan was made. But now it has extended to 23 states. We need more vaccines. So we need to also invest in local vaccine production. Some of these things are being developed by Nigerians outside this country in big pharma companies. So we have the technical skill. All we need is just that little support, and government should begin to fund research and innovation. In our mango farms and in our country, we have very, very medicinal roots, herbs, fruits. But we need to do the appropriate research to just extract those medicinal properties, and then not allow people then consume all that, including the toxins that then affect their health.
Right, and how empowered are local leaders, to help in this education campaign against the dangers of Mpox, and what those basic things that residents need to know to be free of it?
So yeah, local leaders, including traditional and religious leaders, they play a very critical role in health awareness. In most of the success we've had in terms of health campaigns, we know how much the importance of involving community leaders and religious leaders. But the truth is that some of them are unaware, are not aware about how to prevent and what needs to be done to prevent this spread of Mpox. So it goes on health authorities to then engage these leaders and pass the information across to them. And this information needs to be passed in a manner that they understand, in the language that resonates with them, using medium that they know. Like, it makes no sense putting only in social media when these local leaders that needs to spread information, they listen to maybe small radio, or some of them do not have access and they have to listen to maybe traditional town criers, right? So we need to communicate, right, in the right languages. Our country is a diverse country with a lot of languages. So speaking only English or the 3 major languages is not a proof that everyone would hear that right message. So yes, I think we need to communicate more. We need to spread this information using other means of communication that resonates well with both people in the local communities and our local leaders. And then we should engage our leaders. And for leaders who are watching us here today, at least you can spread this information to your audience, because we know how influential you are. Tell them, please, to avoid those animals that help the spread of Mpox. If someone is ill, let that person go and seek care. And if we observe that people are having lesions and this is not a time to touch them, and let them go to the hospital, please support the spread of it. And the simple things people can do: support your community by encouraging them to wash their hands. And I think if we all do this and all play our roles, individual roles, we're going to support the government's effort to prevent the spread of Mpox. And please also, let's also hold government to account. Our leaders, we need to hold the state government account to fund more health care, to fund surveillance in the state, so that together we'll prevent the spread of Mpox.
Okay, so how effective or how trained are health practitioners to handle this Mpox? Remember the era of COVID in 2020, when a lot of health practitioners were not even trained to understand what COVID was, and so it's almost got out of hand. But for Mpox right now, do you believe that health practitioners have been adequately trained to handle this?
Now, I don't think that they have been adequately trained, but there are opportunities for them to train. There have been structures, including self-paced learning platforms, that have been used during the cholera outbreak, Lassa fever outbreak, COVID outbreak. I would encourage the NCDC and other government authorities to use some of these platforms to ensure that the right message is passed to the health workers. So our health force needs to be well trained. But then there are other issues, right? One of them is, do they have the protective equipment? Simple things like gloves, right? Some health facilities in these states, they don't have gloves, and sometimes they expect patients to buy these gloves. For someone who is poor and maybe with case of Mpox that can't even afford a glove, the health worker is at risk, because then he or she is not protected. So in addition to training, we must ensure that we provide the right tools for our health workers to do their work. And then the other problem, which is also a bigger problem, is the lack of human resource. So most of these communities, there is no adequate human resource, and we make use of ad hoc volunteer staff who are volunteering, who are not always there. And sometimes in the case of outbreaks like this, since they are not being paid, they're just volunteering, they stay away. I then find out that some of these health centers are not manned by any health worker. And then if someone has a case, the person is left and maybe spreading the community without even knowing how to protect or isolate him or herself. So we have real challenges in our health system that needs to be fixed. And I think we all need to come together to address this, train our health workers, make sure we have enough human resource for health, and then also we're providing them with the right tools to do their work safely.
All right, Dr. Obinna Iberim, we thank you very much for your insights on curbing Mpox in Nigeria. Many thanks.
You're welcome. Thank you.